Hi, I'm Larry Kestin, a radiation oncologist in Michigan. I am the medical director of the Michigan region for Genesis Care, MHP, Radiation Oncology Institute here in the Detroit metropolitan area. For patients with intact, locally advanced non-small cell lung cancer, how should chemotherapy and radiation therapy be delivered? And what's the optimal dose and fractionation in this setting? Well, concurrent chemotherapy and radiation treatment has been proven to be superior to sequential chemotherapy and radiation treatment for locally advanced non-small cell lung cancer in numerous randomized trials over many years. So we would typically give the treatment concurrently in this setting. Typically, a platinum-based chemotherapy regimen is given with either cisplatin or carboplatin, and then that would be paired with a second drug that is either paclitaxel or etoposide or pemetrexed, especially for non-squamous histology. And then the radiation treatment is given using standard fractionation typically, so 2 gray fractions on a once-a-day basis for 5 days a week for a total dose of 60 to 70 gray over 6 to 7 weeks. It is clear that a dose of at least 60 gray should be given. Beyond that, it is unclear, although some will advocate for doses of 66 gray or 70 gray total, as long as those doses can be reached while meeting all reasonable critical organ constraints. Doses above 70 gray are not recommended, and that is primarily due to the findings of RTOG 0617, where 74 gray was proven to be inferior to 60 gray in standard fractionation. So I would still say that 60 gray and 30 fractions is probably the most common regimen that's used, but some will advocate for doses even up to 70 gray, as long as that is easily achievable with a reasonable RT plan. The target for the radiation therapy is the gross disease based on CT and PET scans without addition of any elective areas. So we target the visible disease on imaging to 60, 70 gray concurrently with chemotherapy. And of course, since the Pacific trial, concurrent chemotherapy and radiation treatment is typically followed by immunotherapy for these patients.